Hello, everybody. Welcome to Managing IBD during the COVID-19 pandemic. I'm Laura Wingate. I am the Senior Vice President of Education, Support, and Advocacy for the Crohn's and Colitis Foundation. And thank you all for joining us this evening. It's our pleasure to bring you all together in this virtual format to provide some education, some updates on COVID-19. And I'm really thrilled to be with this distinguished panelists this evening, who I'd like to introduce right now. I'd like to start with Dr. Tolulope Falaiye from Children's Hospital, Colorado, in Colorado Springs. And Dr. Falaiye is a pediatric gastroenterologist. I also like to introduce dietitian Kelly Issokson. Kelly, would you please wave? And she is from Cedars-Sinai. And lastly, I'd like to introduce Dr. David Rubin. Dr. Rubin, would you please wave? Dr. Rubin is an adult gastroenterologist from the University of Chicago Medicine. And also tonight, I'd like to thank our sponsors of tonight's program. Those would be AbbVie, Genentech, Gilead, Janssen, Shire, and Takeda for their generous support of all of our COVID-19 resources and tonight's Facebook Live program. As a reminder to everybody on the call this evening, the information provided tonight during this chat is for educational purposes only. It should not replace the advice from your gastroenterologist, your dietitian, or your surgeon. If you have questions that are specific to your care, please reach out to your healthcare provider. We want this to be educational, but if you have specific questions, reach out to your physician, nurse practitioner, or other healthcare provider. So without further introductions, Dr. Rubin, I'd like to start with extending a question to you. You were on our last Facebook Live where we gave some updates on COVID-19 and SARS-CoV-2. Would you start this evening by sharing any additional information you can about the risk of testing positive for SARS-CoV-2 and developing COVID-19 for patients with Crohn's or ulcerative colitis? And really what I'm asking is, are IBD patients at higher risk?
Thanks, Laura. And let me just start by acknowledging the foundation, the Crohn's and Colitis Foundation, as well as many of our other professional societies have been working together in unprecedented fashion, really, to help us as professionals and to help, very importantly, all of our patients who have inflammatory bowel disease. So I wanted to just acknowledge that and thank the foundation for all the work they're doing, and specifically thank you as well, Laura, and all of your staff and team for what they're doing. Now, let me get to the questions. Fortunately, we've now learned a bit more about this. The first time we had the Facebook Live, we were still in the early phases of the pandemic in the United States, and there was a lot we just did not know about how this may or may not affect our inflammatory bowel disease population. And what we've now learned, and what the experts continue to agree upon, is that having Crohn's disease or ulcerative colitis in and of itself does not increase your risk of contracting the virus called SARS-CoV-2, or if you have the virus, it does not specifically increase your risk for developing the disease called COVID-19. We've learned that the biggest risk factors remain the same as those in the general population, which are if you're over age 60, or if you have other comorbidities, which include having diabetes or high blood pressure or pre-existing lung disease, including people who smoke cigarettes. And we've now learned predominantly from our experience in the United States, unfortunately, that if you are overweight or obese, that also plays a role into how people do with these diseases. Having IBD in and of itself is not an increased risk. We know people are nervous about their medicines. We'll talk more about that. But for the most part, that's been very reassuring. And one of the things that I want to drive home tonight is we've also learned what works. We know that when people are practicing social distancing or staying at home, or when they need to go out and when they're doing other things, if they wear a mask, if they wash their hands, if they're paying attention, we know that it does prevent people from becoming infected. That does work. So despite the other pressures that many people are facing financially or even politically to start going back into society, we know what works. And while we're still working out some of the details of the science here, which remains very important, we want people to know that they should continue to follow the CDC guidelines and take good care of themselves. And we'll come back to that message in many ways. But the main thing to start with tonight is that if you have Crohn's disease or ulcerative colitis, you are not inherently at increased risk for getting the infection or developing the disease. And that's a very helpful message.
Thank you. That is very reassuring to hear. And Dr. Falaiye, would you tell us about the pediatric patients, and is there a greater risk for that community?
Yes, thank you. I echo everything that was said by Dr. Rubin about the great work that the foundation and your team has been doing. And the same is true of pediatrics, that having Crohn's disease or ulcerative colitis does not increase your risk. And by the way, children get less severe disease than adults do with the infection. They're less likely to catch the infection, less likely to get very sick from it. So that is also true in our pediatric inflammatory bowel disease patients. In fact, we've been tracking internationally the patients with inflammatory bowel disease to see how many people get it and what their outcomes are. And so far, as of May 12th, in the US, only 44 children with inflammatory bowel disease have been reported to the Secure IBD registry to even have contracted the virus. None of them required ICU stays, none of them died, none of them were put on ventilators. So they did not get severely ill from contracting that infection. So the same is true. You are not at increased risk for the most part. We'll talk about medicines in a little bit, from having inflammatory bowel disease, and that does not increase your risk for having the disease COVID-19, which comes from contracting the infection.
Thank you. Dr. Rubin, I'd like to ask you another question. The number one thing we get asked at the foundation from IBD patients is how their medications should be managed with the risk of SARS-CoV-2 and COVID-19. Can you provide an overview of the current guidance that's available as it relates to IBD patients who are generally in good health, those that may be experiencing a flare, those that might be suspected to test positive for COVID-19, and then those that actually develop COVID-19? Can you provide some guidance around the medications in those different categories?
Okay, so there's a number of questions there, and they're all very important. Let me start by saying that what I'm about to share, for the most part, is based on a variety of sources, and it's important for people to know. There's a group called the International Organization for the Study of Inflammatory Bowel Disease that represents physicians, scientists from different countries around the world that has been working from the beginning of the pandemic, even before it really hit the United States, and developed consensus statements, which are based on what the experts agree makes sense, even when there weren't very many data to guide us. And then there's also been a number of publications and suggestions or recommendations from the American Gastroenterological Association, and a number of other societies around the world have issued recommendations for people who have inflammatory bowel disease. The number one message has been that you should stay on your medicines if they are working and you are in remission. That is a consistent message across all the societies and all the experts. And the message there is based on a couple things. Number one is if you're otherwise practicing social distancing and hygiene and doing what you need to do to take care of yourself and protect yourself and your family, staying in remission is much more important than stopping your medicines in that scenario, for sure. And that also goes to the fact that what we've learned is that if you start to flare or you get sick from your IBD, then needing to see the physician or have scopes or do other things that might require escalation of therapy or the use of corticosteroids puts you at higher risk in general than just taking good care of yourself and staying on your maintenance therapy. So one of the main takeaways tonight should be that if you're stable, doing well, stay on your medicines. And of course, as you already heard, if you have questions about this or you're not sure, you should really be checking with your healthcare team so they can guide you further. But that is a consistent message. Now, the next message is that of all the therapies that we currently have available for inflammatory bowel disease, the one that we are most concerned about are corticosteroids. That means prednisone. And prednisone, which we've used for many years in IBD, and probably everyone who has inflammatory bowel disease may have been on it at one point or another, works short term, but we know it's not a good long-term medicine for IBD at a baseline. But what we also learned over many years is that being on steroids increases your risk for other infections. And the same may be true now with this particular infection. And now with an international registry of patients who've had COVID-19 and also have IBD, as we're starting to analyze it, and when we're looking at some of the individual countries that are reporting their IBD experiences, the one consistent message continues to be that being on steroids is associated with people getting sicker when they get infected. So if you're on steroids now, what are you supposed to do? Well, you need to be talking to your doctors. You need to be aware that the other treatments available to manage IBD are judged to be safer and are appropriate, and you should be on one of those steroid-sparing strategies. You should be safely getting down on your dose of steroids, and that needs to be guided by your physician or nurses. And when possible, you can switch to non-systemic steroids, like a drug that is called budesonide, or even rectal therapies when they're appropriate. So that's one of the main messages. Now, going further into what Laura asked me, if you develop an infection, let's say you find out that you have SARS-CoV-2, and it's even before you develop COVID-19, and now that there's more testing around, or maybe you've been exposed and then you get tested, this may actually be a real scenario for some of our patients. Well, the guidance has been that most people who get infected with the virus will develop the disease within about 2 weeks. In fact, many patients get symptoms within about 5 days. But it's that 2-week period of time after you find out that you have the virus that we've recommended that you hold your immune therapies. Now, that's a complicated thing, and I won't go into all the details quite yet, but the bottom line behind that is just not to continue dosing immune-based therapies to allow your body to react to the infection and to allow you to recover properly. If you get the disease called COVID-19, that means that not only are you infected with the virus, but you develop symptoms, fever, cough, congestion, shaking, chills, and what we know, of course, now is GI symptoms can accompany this, which can be diarrhea or abdominal pain. Almost always the GI symptoms, by the way, come with fever and cough. So it won't just be that you have a cramp or a little diarrhea, you're going to know. If that happens, then we're also recommending that you're holding your therapies and talking to your physicians, at least those immune-based therapies. So what are those? The biological therapies, your azathioprine or 6-MP, methotrexate, but you got to do that with your healthcare team so they're aware of what's going on and they can support you. If you're on the medicines called aminosalicylates or 5-ASAs, that would be like Lialda or Prizo, Asacol, Pentasa, sulfasalazine. We think those are probably safe based on what we've known in the past with those treatments. And the consensus of the experts says you stay on those. That should be okay. And there's some ongoing work looking into that. If you're taking an antibiotic for a different reason related to your IBD, you can probably stay on that. If you're on a nutritional or dietary therapy, which of course is the realm more of our pediatric experts, you should stay on that. So there are some things that are easy to stay on, and there's others that you would come off of just for the time while you're sick. And then we're having ongoing discussions, but most people would restart therapy after their symptoms resolve. So I recognize this is a lot of information. To summarize, the main message, stay on your medicines if you're in remission. Work extra hard right now to come off steroids safely, working with your doctors. Don't start messing with your medicines without talking to your team so you know what your options are, because you don't want to get sicker from your IBD and then end up in the hospital and dealing with that scenario. And we'll get into a few other things related to this as we go on, but I think it's important now to hear from my pediatric colleague. So let's talk a little bit more about that.
Absolutely. And the Pediatric National GI organization has come up with similar recommendations that people should stay on their medicines. We do recognize the increased risk with steroids, and for that, it's absolutely important not to stop that medicine just outright. If you stop that medicine, you can get sick from just stopping it quickly, either from the inflammatory bowel disease or, depending how long you've been on it, from other reasons. So that is essential to contact your doctor and work with them, or your nurse practitioner, whoever takes care of your inflammatory bowel disease, work with them if you are on steroids, but otherwise stay on your medicines. We do not want you to get more sick by stopping your infusions or your pills or your injections, whatever therapy you are currently on.
Laura, if I could follow up with one more point, because there's been a lot of
Absolutely.
discussion in the professional and in the patient community about whether some of the therapies patients take may actually be protective in the scenario of getting infected with SARS-CoV-2 or developing COVID-19. And I wanted to try to provide the folks tonight with our updated thinking about some of this. The first point is that when someone becomes inoculated or infected with this virus called SARS-CoV-2, there are two phases that occur when you develop symptoms and the disease called COVID-19. The first phase is the infectious phase. So this is how your body is responding to an infection. It's when you develop a fever, which is there to help you fight an infection. It's when your immune system becomes activated to try and deal with that. And you may develop some of the early symptoms of a cough, congestion. Some people describe loss of smell or taste, or even some of the GI symptoms that we've heard about. During the infectious phase, your body's trying to get rid of the virus. So when we're talking about treatments for COVID-19, when we're thinking about the first phase, it would be about how do you get rid of the virus, or do we have antiviral therapies? And so some of the research that's going on for drugs that you may have heard of, like remdesivir or hydroxychloroquine, or even some others, are focused on can they prevent the virus from replicating and reduce the infectious burden in your body. So that's the first phase. And in fact, there are old data that suggests some of our medicines in IBD may have some antiviral properties. Enough that we know everything we need to know? Absolutely not. But there are some old data on azathioprine and 6-MP, surprisingly, that suggests they may have some antiviral properties. It's a complicated topic, but it may exist. Even the old medicine that we call Pepto-Bismol may have some properties like that. That doesn't mean you should go out and start taking Pepto-Bismol. Please don't misinterpret it. But the second phase is when the immune system becomes overactive, just like what we talk about overactive immune system in your intestines. And the second phase is called the inflammatory phase. And this is when people get really sick. Sometimes it's because their body can't get rid of the virus, and we think sometimes it's because the body loses control, and then this inflammatory phase starts to spiral. This is when people develop shortness of breath, they have pneumonia on their chest x-rays, they may need hospitalization or to be in an ICU, or unfortunately, this is what happens when people die. They actually develop congestion and fluid fills their lungs, and they have an overabundance of inflammatory proteins. In the inflammatory phase, the therapies we have that are anti-inflammatory that we use for Crohn's and colitis may actually be helpful. But we don't know enough yet how we would time all this with your infection or developing the disease, except to say that there are ongoing clinical trials right now looking at some of the anti-cytokine or anti-inflammatory protein type treatments that might be helpful in the inflammatory phase of COVID-19. So you can understand there's a bit of a dichotomy or a paradox here. On the one hand, you may be on immune therapies that might increase your risk for certain infections, as many of you know about. And on the other hand, those same therapies further down the road in the COVID-19 disease may actually reduce the consequences of that. So we're working hard to figure this out. The main message now is let's do what we can to prevent it. If you have the infection and you develop the early phase, hold the therapy so that your body might respond properly. And God forbid you get sicker and you're in the hospital or ICU, then that's going to be up to those experts to decide whether there's other treatments that might actually help the IBD at the same time. So I know this is really complicated, I'm sorry, but I think it's really important that you hear the complexity of all this and why there are some mixed messages out there. So hopefully that helps.
No, Dr. Rubin, I think that was the clearest explanation I've heard, explaining that phrase that our drugs, the IBD drugs, may be protective, and what the description you just provided was wonderful, and I do think it's very beneficial to the IBD community. So thank you for doing that. I also wanted to mention that all the recommendations and all the information you just shared about the medications is on the foundation's website. So people can go to the website and you can use that information and share that information with your healthcare team. I did want to do a follow-up question to both doctors. I understand that many of the recommendations you've just shared are made by experts in the IBD community. Can you explain to us how expert opinions are developed by IOIBD and the AGA and the other societies? And how does that process differ from practice or clinical guidelines that physicians use?
Okay, sure. Do you want to start?
And so, sure. So when we say expert opinion, it means that there's not enough data for us to be able to clearly say that we know, as far as you can know scientifically, one thing from another. That's not because we're not looking for the data, it's because the data is currently being collected in clinical trials, as you heard about, that are going on right now. And so once those trials, which have to be conducted in the right way, we want to make sure that they give us fairly clear answers to the questions that are being asked. And we don't want that muddied by something being rushed or being done in a way that is not scientifically proper. Once that data comes out, you can then make a more clear statement, which you wouldn't call expert opinion anymore. You would call like a clinical guideline, or depending on how much data you have.
I think
Before
it's,
you get
oh, go ahead.
Before you get to that stage, the people who take care of the disease, who know how the medicines work, who know the current science about how the disease itself works, will make recommendations based on their knowledge. And that's what we're seeing now of these expert opinions. And so in pediatrics, that's the pediatric doctors. A lot of those organizations you mentioned are primarily adult doctors. Sometimes it's even a group of doctors that are not just from one specialty, depending on what the organization does and who's involved in it.
It's a really important question, Laura, and it actually transcends this pandemic. It also lends itself nicely to what we often do when we're faced with a disease or a question. We go to the internet. And so people are always looking at things on the internet, and they don't necessarily know what to believe or what's more valid or credible than something else. So consensus opinions are when you take a group of experts who have a level of experience and accepted expertise, and you get them into a room. And there are different methods that we use for this. There's actually a methodology to the whole thing, that you can look at whether or not they're in agreement, and they actually can disagree and work through it and come up with what they consider to be consensus statements, which means the majority think that this statement is accurate. So that's what consensus statements are, and they often are used when there is a complex situation and limited data. So the consensus statements that led to the current guidance for patients with IBD and COVID-19 is based on experts. It's based on the data from the prior SARS epidemic that occurred in 2002 and was limited at that time mostly to Asia. And it's based on other knowledge we have about the medicines and how they work and what we've learned from them. Guidelines, as you already heard very nicely, are based on some consensus, but more often are really based on available high-level scientific data, where there's been a hypothesis that's been tested and then proven, either with a small single study, or the highest level would be multiple studies that are randomized, where people don't know the arm that patients are in or what treatment options someone might have received, and where the results are consistent across multiple randomized trials. That's the highest level of evidence. So when you see something on the internet where someone says, we've developed a new treatment for Crohn's disease and it works in 25 people, that is important. It may generate future hypotheses. It may even be right, but it's not at the level of evidence where we say we know it's right, where we can put it in a guideline. It might lead to future studies. If you hear somebody say, in my opinion, this is something we should do, Well, then you want to know is what's the level of expertise of that person? Where do they get their opinion? And so I hope that this helps clarify. Right now, the guidance for COVID-19 and IBD is largely consensus opinion based on prior data, but more we're starting to have current data that is guiding some of our recommendations, like the information we've now learned about steroids, for example, and the emerging reassuring information about the general population of IBD, and frankly, the information we have about taking precautions like staying home or wearing a mask or washing your hands properly and how you can prevent yourself from getting infected. We've learned that in society, we've watched the numbers change, and we've learned that in our own hospitals where using appropriate protective equipment protects our frontline healthcare workers from getting infected. Same general principles.
Thank you. I really appreciate both your explanations because there is so much information on the internet, some of it credible, some of it not as credible. And this is really helpful to hear the explanation of the consensus and the guidelines and how they differ and how all this information is being developed and changes as more information comes out. Speaking of the internet, I was recently reading a published article from the Journal of Gastroenterology that offered some really encouraging news for the IBD community about the test for positive test for SARS-CoV-2, and that there was a good prognosis for the IBD community. Dr. Rubin, are you able to share some of the highlights of that article and what it means for the IBD community?
Well, the article you're referring to, I think, is the one from Spain, where they described 40 patients with IBD, mixed ulcerative colitis and Crohn's. And a small number of them, I think it was a third or so, who were on biological therapies or immunosuppressants. The other remainder were on the 5-ASA therapies. And the bottom line was that when they found out they were SARS-CoV-2 positive, and in some cases when they had symptoms and had COVID-19, they held their medicines, as has been suggested and recommended. And this population of patients did very well. There were 2 patients who died, though, and they actually were both patients who were in their 70s or 80s and had other comorbid problems. So once again, as I started tonight, the big risk is age more than having the IBD, and based on this series, the medicines you're on. We have similar data now from NYU in New York City, where you are, Laura, that published in the New England Journal of Medicine, that not just IBD patients, but they combine patients with rheumatoid arthritis, lupus, psoriatic arthritis, other immune-mediated diseases that are treated with some of the same medicines. And this also suggested that overall our biological therapies were safe in this population. The hospitalization rate they reported for this population of, I think, 86 patients was similar to the general New York population. And they did see a signal with steroids and older age, as we've mentioned multiple times tonight. And I think that that's also reassuring. So as we're accumulating these different series from different cities and different populations, the same message comes out that reassures us. Obviously, we have to keep looking and keep asking good questions so that we can get better answers.
Thank you. I wanted to throw this question to our entire panel. And Dietitian Issokson, I'd like to start with you and then go to Dr. Falaiye and then Dr. Rubin. What are the most important recommendations for IBD patients that can be taken from each of your point of views right now? What should they be doing right now to protect themselves and their family? I think I know what you might say, but I would love to hear each of you tell me your opinions. So, Dietitian Issokson.
So social distancing is really important. Try to stay home as much as possible. You can still social distance and participate in physical activity, but wear your mask or your face covering. Try to maintain at least 6 feet of distance between you and the next person. And then wash your hands frequently. And of course, eat a healthy, balanced diet.
Thank you.
Absolutely agree with that. That's huge. I'll take a slightly different track, which is I'll touch on mental health. We want people to stay healthy and strong in their mind as well as their body. And so you've already heard the body part, which is both staying on your medicines if you're in remission, trying to avoid catching this, but keeping your mind in balance, which means things like getting up in the morning and not staying in bed till 2, which means things like doing things, reading. The Crohn's and Colitis Foundation has a wonderful section on the website that talks about some of these practices. Staying in contact, you can call someone, whether it's a video chat or whether it's on the phone. Stay in contact with your family, even though you can't be in a big room together, but it doesn't mean you don't have to contact them at all. With your friends, if you participate in meditation or yoga, giving your brain some work to do, which doesn't mean watch the news 24/7. In fact, we would say don't do that. but do keep up with keeping your mind active, crossword puzzles or Sudoku or whatever it is that you enjoy to do. If you enjoy painting or reading, do some of these things so that your mind stays healthy and strong. Um, we don't want people to just stay home with the curtains drawn all the time, and not go outside if you have good ability to social distance, because that's just not good for you. And your mind and your brain and your body are connected. So please keep your mind healthy.
Great.
I have two suggestions that my colleagues haven't already mentioned. I'm very much goal-oriented in the way I take care of patients with IBD and in other ways. And so my suggestion to folks, especially now, is to set obtainable goals for yourself, and they can be on a short time horizon. So this week I'm going to fill in the blank, and maybe you'll do something you haven't done or that you've been meaning to do. I pulled out my trumpet that I played my whole life but haven't played as much lately and have been annoying my family. But I would say setting goals, just like we say that one of our goals for managing Crohn's and colitis is to achieve remission and then sustain it. That is an important goal. But I would encourage people to use this challenging time to think about new ways to improve themselves. And by challenging themselves in this regard, I think it will help. And we're going to keep fighting and working on this until we have some better solutions for everyone. I'm very optimistic about that, though, and I agree completely about not watching too much news.
I always learn something new about all of our panelists every time I do one of these. Now I know David plays the trumpet. That's interesting. Dietitian Issokson, you mentioned maintaining good nutrition. So can you provide some recommendations for patients on maintaining good nutrition while they're socially distancing and experiencing limitations in our supply chain, particularly when it comes to meat and dairy products right now?
Yeah, I'd be happy to. And thank you to the foundation and my fellow panelists for having me today to talk about nutrition and its importance in IBD. We know that nutrition or a balanced diet is important for IBD patients because it helps them respond better to their medications. It can help them feel better. And we also know that malnutrition is common in IBD. So nutrition does play a role in immunity and infection. So if you are malnourished, you could be more likely to develop an infection. So if you are thinking that there's a degree of malnutrition that's happening, if you've lost weight, if you're not eating as well, if you have a poor appetite or feel weak or tired, please reach out to your provider, your physician, nurse practitioner, your dietitian, so that we can help you, even if it's through virtual counseling. It's important to address those aspects of your care so that you can do better in the long run. Currently, there's no strong evidence to support any specific food or supplement in terms of preventing or treating a COVID-19 infection, but again, nutrition is an important part of immunity and preventing infection. So we want you to eat a balanced diet. Some of the challenges that I'm hearing from my patients with regards to access to healthy foods include physical access challenges, such as having to stay at home or social distancing, not being able to go grocery shopping, financial concerns such as loss of budget or decreased budget due to loss of job, or maybe your hours have been cut back at work, or even when you're in the store or shopping online, there can be a lack of availability of the specific product you're searching for. I know here in LA, we have lots of produce and canned goods, but we've been experiencing less access to things like eggs and dairy and grains. Over the last few weeks, the access has improved, but I'm sure this is specific to each different region in the nation. So what I encourage is to do some online shopping instead of going to the store. That helps address that physical challenge with regard to access to healthy foods. There are a lot of stores or bakeries or local restaurants that offer online shopping or even curbside pickup, and that can significantly reduce your risk for getting sick and definitely reduce your or help you to improve your social distancing when you're shopping. Also, if you have a local farm or if you have access to community supported agriculture, a CSA box, I know that some local farms are offering delivery to your door, so you can get some fresh produce packed up and delivered weekly or twice weekly to your door, and you can definitely maintain social distancing that way as well. You can additionally reach out to your dietitian or social worker if you're having difficulty with getting proper money to get food. There are government programs that provide funds so that you can purchase fresh fruits and vegetables and other nutritious foods, and your dietitian or social worker can help you with that. One example is a Supplemental Nutrition Assistance Program. So you might be eligible for that if you have lost your job recently, or if you're, having to cut back on your hours at work. And then in terms of making sure your diet is balanced, there are a couple of principles that I wanted to point out. Well, the major one being try to include a protein-rich food every time you're eating, along with 2 plant-based foods. And there's more information on the Crohn's and Colitis Foundation about this, but don't just try to think outside of the box. Things like frozen foods, canned foods, dried foods, those are all good, healthy, and nutritious. A lot of people associate like canned foods with being unhealthy, but if you have canned green beans or canned beans or frozen chicken or dried fruit, those are really good, nutritious sources of food that you should be including in your diet. Some of the staples in my pantry include canned tuna, canned chicken, dried beans or lentils, dried rice. I also have some nuts or nut butters, like peanut butter and almond butter. Those are nice shelf staples. They last a long time, and you can access those foods or use those more in your cooking when you have less access to fresh foods available.
Kelly, you want to share your hobby since I've seen you tweet it out recently?
So yeah, something that I've been doing to help my mental health and also plan for the future is I've been gardening. So I have a nice backyard that I'm privileged to access, and I've put up a couple of raised beds, and I'm gardening, and it's really therapeutic. I'm seeing fruits and veggies grow in my yard from seed now to little sproutlings and or seedlings, and they're just so cute. But also they're going to provide me with good nutrition in a few weeks, and I'm really excited about that. But it's been really therapeutic.
That's a great recommendation on the mental health as well as the nutrition aspect. And Dietitian Issokson, we are sharing the links to the resources that you helped us create, including the food assistance programs. And I was wondering, you helped us create a sample diet for patients and caregivers to follow while they're isolating. Can you provide an overview of those recommendations tonight? And we'll shoot out the link to everyone so they can see that diet plan that is on our website.
Yes, absolutely. I'd be happy to. So if you have the ability to click the link that was shared, if you scroll down, there's a table that was created. And on the left side of the table, there's a column for proteins. And on the right side of the table, there's columns for fruits, vegetables, grains, and fats. And back to that principle of having a balanced diet and a balanced plate, you want to make sure and include a protein-rich food along with 2 to 3 plant-based foods to get that nice balance and nice macronutrient ratio that we like to see, because that's going to ensure that you're getting good protein as well as fiber and antioxidants to help keep you healthy and nourished. So if you look at this table, most of these items can be found in your pantry or freezer. And again, these things can be fresh or frozen, canned or dried. And then if you're on a low fiber diet, you can modify some of the things in this table to help fit your dietary needs, such as peeling fresh fruits and vegetables, cooking vegetables so that they're nice and soft and well cooked, avoiding whole nuts and seeds and instead choosing creamy nut butters or seed butters like tahini, and then having things like bean purees like hummus or vegetable soups or smoothies. So some meal ideas to get you started, an example of protein and 2 to 3 plant foods would be for breakfast having an egg omelet with sauteed zucchini and some toast with smashed avocado on it. I don't know about where you are, but here in California, we love our avocados. An example of a good lunch would be tuna salad sandwich. So you have your tuna protein on your grain bread along with carrots, and then you can finish that off with a nice applesauce with something sweet to tie your meal together. And then for dinner, you could do something like chicken tacos with beans and avocado, or beans and tomatoes, or beans and greens, and then have an orange for dessert, or banana, or maybe a little piece of dark chocolate. Definitely don't forget to satisfy your sweet craving, because that's important as well. And it's, of course, part of a balanced diet.
That's amazing. I should have had dinner before we did this. I'm starving.
I was thinking the same thing.
Okay, that's great. Thank you.
Thank you so much. I wanted to switch gears back to our medications just for a second, because I think it's a question that is often asked by our patients. Doctors, can you reiterate the infusion guidelines and what's important for our pediatric patients to remember, and then our adult patients to remember?
Yeah. So why don't you start?
Yes, absolutely. So first of all, we've already talked about the importance of staying on your medicines. The next question that we've gotten a lot of phone calls and messages about is it safe to come to the infusion center or the hospital to get that infusion? And I'll tell you that our current recommendations are that you continue getting your infusions in the place you've been getting them. So if you're already set up for home infusions, you can continue that. But if you are not, you do not need to switch to home infusions. Please keep in mind that when you come to the hospital, we're screening. People are using protective equipment. All the necessary ways to try to limit the passing of infection are being taken. Specifically in the pediatric population, we encounter a couple of issues, such as if you are a young pediatric patient, you're not a teenager, you're not almost 18, and the home care companies in your area don't have nurses who know how to get blood from a younger child, or don't have the appropriate sized emergency medicines for a younger child, or don't know what to do in an emergency situation, and you're at home, those are things that we are concerned about. And for those reasons, we are asking people not to switch to home infusions because of the current pandemic situation. So it is safe to come to the hospital to get your infusions. Protection is provided to the frontline workers and to our patients, and with the screening guidelines in place, we want you to continue your infusions. You do not have to be afraid that coming to the hospital will give you that infection.
Yeah, I agree. The consensus statement from the IOIBD, and it was repeated in more detail in a couple other papers we've worked on, have emphasized that you should stay on schedule with your infusion therapies. And my just practical advice to folks who are on those, receiving those treatments, is to call ahead and interview your infusion center. Ask them, what are you doing to protect me and to protect you, frankly? And they should answer that they're pre-screening people before they arrive, that they check a fever or temperature when you get there, that the chairs are more than 6 feet apart, that there's, whenever possible, only a single nurse working with a single patient, or at least that patient only sees one nurse during the visit, that the infusions are done in the most efficient and expedient way possible. At the University of Chicago, we just switched, after reviewing the data, to providing infliximab infusions in an hour instead of previously 2 or longer, and that's been our decision, but every place looks at it a little differently. But you want to know all that, and you should demand it and ask so you're feeling comfortable. There are situations, though, where home infusions might be needed, and those should be the exception rather than the rule. And I think it's important to acknowledge that, but it has to be done very carefully. The only other thing to mention is that some have asked, should I switch from my infusion to an injectable, something I'll do myself as an injection? And the current guidance and recommendation is that we would not support doing that, that when you're receiving an infusion therapy, the drug may be stable at a certain concentration, and making that switch may not be equivalent for you and may put you at risk. And an older study where they tried to do that actually resulted in flares, and so we've learned not to do that at the current time. So stay on your medicines, but it's okay for you to call ahead and demand and ask about what's being done to keep you safe. For the most part, though, we found infusion centers have been very proactive about this. I just looked at all the numbers from our center, and they haven't dipped at all through this entire time, and that's a testament to our wonderful staff and, frankly, to our patients for trusting us and continuing with our plans.
Thank you. That's really helpful to reassure everyone to continue with their infusions and site of care. I know one of the things that the foundation's receiving a lot of questions on as we hear about the economy reopening and different states reopening is guidance around what to do about work and school. So I'd like to ask each of you a question related to that. So Dr. Rubin, what guidance would you give IBD patients in terms of returning to work, going to their doctor's visits? What's the risk of exposure? What's your recommendation?
It's a complex question, but it deserves an answer. The answer is that we're not at a point yet where we know how to protect everyone through immunity, meaning we don't have a vaccine, and we haven't reached the point where we think there's enough immunity in the population to have reduced transmission of the virus sufficiently. So that doesn't take away from the fact that people need to support their families, and they have other things that are very pressing they need to do. If you're not a frontline or essential worker, but you do need to get back to work, you need to do everything you can to make sure you still have space between you and the others around you. It's very clearly demonstrated over and over again that when you're in close quarters, no matter how careful you try to be, you're more likely to get infected. That if there are options for you to do things remotely, you should continue doing those. And that when you're in your place of work, you should still be adhering to the CDC guidance, wear masks when you are able in appropriate situations, wash your hands carefully. Actually study how you wash your hands. Everyone does it with a certain pattern that they've developed over the years. And you may be surprised to realize that you're missing the sides of your thumbs, or that you're doing something consistently all the time where you're always missing part of your hand. So just work on those types of things when you do need to go back, and it's reasonable and appropriate to ask your employer to provide some other precautions. If you are a frontline worker or an essential worker where you are out of necessity being exposed to people, whether that's in a healthcare setting or all those other very important people who make our society function, are keeping us going and delivering all that food to Kelly's house, I think that you need to know that those individuals should also be very careful. And if you're one of those folks, it's important for you to take precautions, and you also need to talk to your healthcare team. It may be that they'll recommend that because of your level of exposure or the inability to provide adequate protective equipment, that you shouldn't be working right now, and that you might need to stay home longer. And so I think it's important to have a dialogue about this and to think about what is your risk of exposure, what is your accessible and available protective equipment, and then what is your risk as an individual. As we've already explained, having IBD isn't the risk. Even most of the medicines you're on aren't the risks. But if you're older and you have other comorbidities, if you're over 60 and you're on and you have diabetes, for example, in addition to your IBD, well, that's a high-risk person and it has nothing to do with your IBD. And so that requires a conversation with your physician or your healthcare team, and they'll help you.
Thank you. What about our pediatric community, returning to school, going to sporting events, social activities? What guidance would you give pediatric parents and young adults?
Yeah, so for the pediatric population, the more pressing one I would say is camp, which I think we're going to talk about in a little bit. But camp activities are coming up, and the question of whether you should participate or not, how you protect yourself. I would say I think almost all the school counties have been closed for the current school year, as far as I'm aware. People are wondering what will happen in the fall. And again, we don't have enough information right now to know exactly what that's going to look like. We'll probably need to have an element of social distancing. We'll have to see if, as the states open back up, if there's a resurgence of new cases, or if the curve has been flattened enough and stays flat enough where we can then proceed and continue to open things up. Again, the great news is children are at less risk than older people. And so we're not worried that kids are going to suddenly get very, very ill. However, they can pass it on. So we don't want to increase the rate to their parents, their teachers, the other adults that they are in contact with. And so as people go about their days, please social distance. And this is hard when you have a brood of kids and everyone wants to run a different direction. We do recognize that. And kids, share everything, right? Like, take a lick of my whatever they're happening to be eating. We do understand this. I'm not saying this is an easy thing by any stretch. But social distancing is important. Getting your kids to wash their hands. With kids, you can do have them sing Twinkle Twinkle as they wash their hands. If you get some kind of a song or make it some kind of a game, you're more likely to engage them. And I completely agree with making sure that you're covering all the surfaces of the hand, with soap and washing for the right amount of time. But you can absolutely teach a kid to do this in a game form. Those are going to be important things to start with. So if you're looking at your activities, ask about these things. Are they planning to do any social distancing? Do they have places where people can wash their hands? If the answers for those are no, you might want to think about not participating in that at this time. We'll see about the fall, but those things will still be important. The activities you're participating in, they also need to have things like, are they asking people to wear face masks? Because you could be wearing your mask, but if you take your mask off to scratch your nose and the person next to you is not, they can still infect you. It's less if they're further away, but these are things to think about. Are you going to be tight packed in an area? Maybe that's not a place you want to go to right now, especially if there are adults with high risk, with those comorbidities that you've already heard about in close contact in the household. We don't want to put them at risk, even if the kids will likely have no symptoms. So those are the questions that I would ask about any activity that you're looking to participate in. What are they doing to protect people as they open up their activity? And if the answer is not much, I would say hold off for now.
That's very helpful. And since you brought up camp, you were part of the decision makers that helped the foundation come to the very difficult decision to not host our in-person Camp Oasis program this year. But we are going to be hosting it virtually, and it's
Yes.
going to be a whole new world for camp this year. What guidance would you give parents that might be considering other camps beyond Camp Oasis, which will be virtual? What is there any additional guidance you would give those parents as they're thinking about their children's summer and what to do in relation to summer camp?
Yeah, so I'll echo. It was a really tough decision for us to say, hey, we don't want to expose people, and we're not at a place where we can hold camp, in its previous form. And so maybe this year we shouldn't do it. That was really tough and sad for all the doctors and nurses and people who participate in camp. But we are very excited about the virtual camp and see what other activities we can come up with in place so that people don't feel like they've missed out completely. I would say those big things, camp is camp, right? Like if you say, hey, where are you going to wash your hands? There's not a lot of places actually. And so if everyone's got their own sanitizer bottle, I guess that's one way to do it. But again, those are things that you should ask the camps that you're looking at. Hey, how are you going to social distance? What kind of activities are they going to be? Were they thinking they would put a big box of crayons right in the middle and everyone would dive into the same box of crayons? Because that would not be social distancing. If you don't have a way where people are going to kind of have individual things and as well as a plan, what happens if a kid gets sick? Does the staff member who tends to them get isolated? Are they going to be testing? These are all questions to ask. What is their contingency plan? Besides, how are you going to isolate people? How do you make sure people are wearing their masks? How do you make sure the kids are washing their hands often enough? And if they don't have plans for how to do these things, I would say maybe skip it for this year.
Could I follow up on this just a little differently? Of course, I agree with that, how terrible this is, not just for the children, but for their parents to not have camp. But actually, it reminded me that I learned the most about vitamin D from dietitian Issokson, who taught me a lot about it. And we always talk about being outside and getting your vitamin D, but that has some relevance to the IBD world. And I was wondering if perhaps you could educate us all tonight a little bit about that.
Yeah, so vitamin D plays a lot of roles in our health. Vitamin D helps us to maintain and keep our bones strong and healthy. We believe it plays a role in immunity. We believe it can possibly reduce your risk for cancer, and it can help. It may help to keep you in remission. So we want if you're inside a lot, you're not getting a lot of vitamin D. It's really hard to get adequate vitamin D in the diet, and a lot of people with IBD are vitamin D deficient. So if you are going to see your doctor or getting your labs checked, that could be one that you could ask your physician, hey, can we check my vitamin D level and see if I'm deficient or if I'm in a normal healthy range? And correcting it is through a supplement. And we don't want to supplement you if your levels are normal. We don't want to over supplement you because there can be problems with over supplementation. But definitely ask your physician if that's something that can be checked on your next lab draw if it hasn't been checked. And it's an easy way to correct it.
So should people who are concerned about getting infected with the SARS-CoV-2 take extra vitamin D, or what would be your suggestion?
There isn't any strong evidence showing that supplementation with vitamin D can prevent or treat COVID infection. So we don't want you just supplementing just because you feel like it's going to help your immunity. So definitely talk to your healthcare provider. They'll let you know what your specific needs are. Your dietitian can do a diet analysis and make sure you're getting enough food-based sources of vitamin D, which include fatty fish and egg yolk and fortified dairy products, non-dairy products. But don't start supplementing before talking to your provider.
That's great.
That's really helpful. And there is a section on our website that dietitian Issokson also helped us develop around vitamin and mineral supplementation. So, if you have questions, read this information and also share it with your healthcare team. Dr. Rubin, I'd like to ask you the last question of this evening. And you've been very active with the foundation's advocacy as well as the IBD community in general's advocacy efforts. And would you share some of the highlights of the foundation and other advocacy groups' work over the last 2 months, really, as it relates to site of care access to medications, and coverage for COVID-19 testing? I know you've been very active in this area, and I'd love to share that with our community tonight.
Well, I think that one of the great strengths of the Crohn's and Colitis Foundation has been their advocacy on behalf of our patients and on behalf of our professional colleagues. Despite the challenges that the government's facing now, you could argue that this is more important than ever that we advocate for our patients who have chronic diseases like Crohn's and colitis. The foundation next week is going to be doing a virtual day on the Hill. We used to do it in person, but this year we'll be calling all of our different legislators across key areas. And some of the priorities include making sure that our patients are well represented, appropriate access to therapies. We're also supporting something called the Safe Step Act, which prevents you from having to fail other treatments to get to therapies that might be recommended by your healthcare team. There's an important initiative related to medical foods that we'd like to continue pushing for to get those appropriately covered by payers and recognized, which I think is a very important priority. And obviously the current challenges that you all face and we're all facing of being at home faced with chronic illness and the challenges of losing your job or losing your health insurance, and making sure that there are safety nets to help you through all of that. There are a whole bunch of resources that the foundation has available on their websites. They also have a wonderful and interactive advocacy page that I would refer you to, and the staff there have summarized some of the key issues. And Laura, please don't let me forget anything else that's really important that I should mention in this regard, because I don't want to leave that out.
No, the only thing, but thank you, Dr. Rubin, you really highlighted the key efforts. And I just wanted our community to know that as all of the COVID-19 issues have arisen with access around getting your infusions, being able to see your doctor via telemedicine, making sure your doctors are paid for the time that they're seeing you on telemedicine, making sure that your drugs that are infused are available through your insurance coverage or CMS, Centers for Medicare and Medicaid Service. The foundation, along with a lot of other patient-facing organizations, have been active on Capitol Hill and at your state legislature, making sure these things are available to you. And on our website, you can find a whole list of relief programs, both at the federal and state level, to help you and know what your state's covering and the access that they've approved as a result of the pandemic. So I appreciate all of our doctors who have advocated with us and all of our patients that have advocated with us over the last few weeks to make sure that everyone has access to the medications and the physicians and dietitians that they need to see.
Yeah, thank you so much. And I think it's important to acknowledge as well that we're banding together with other chronic disease associations and societies so that we have a louder voice to do a lot of these things, which is the key here. And I really do feel like since many of our representatives, senators, and their staff are affected by IBD, but also by what we're all facing right now, they're going to be eager to hear what we have to say from the rest of the world. So I'm grateful for the opportunity to help in that regard. And I know that many of the people logged on tonight will look for ways that they can pitch in.